Welcome to today's Shootout, drugs versus healthy behavior for heart and stroke health. Thanks so much for joining me. Okay, so the topic for today is drugs versus healthy behaviors, or lifestyle is the other name for this. This video is really intended for anyone who's thinking about trying to prevent long-term heart, stroke, kidney problems, and is struggling with how to eat right to do this, how to exercise best to do this, and when to take drug therapies to try to lower long-term risk. This video is also for anyone who thinks that a shootout topic or a this versus that topic involving lifestyle or healthy behaviors and drugs is actually a legitimate thing to be talking about, because most people that are treating patients to lower long-term risk, whether that's a dietitian, a fitness trainer, a doctor, a nurse, generally view the two things going in lockstep with each other where appropriate. I actually think this is a very good topic because even though we generally think of healthy behaviors and drugs going hand in hand, patients routinely tell me that they would prefer a healthy behavior strategy over a drug strategy, even when the evidence that we have about drug therapy is that they would definitely benefit from being on some form of drug therapy. So I think patients often view this as a legitimate issue. I can use lifestyle instead of drug therapy. For many doctors who are working in a very busy time, it often shortens the amount of time they need to spend if they pull out their prescription pad and write a prescription for a medication or change a dose. It's much more difficult to take the time that it takes to really talk to patients about how to use healthy behaviors to lower risk. And so the most efficient way of operating is actually to provide drugs. So you have this dichotomy where patients are often saying, I really want to do lifestyle. Doctors are often saying, I've got a great drug for this. And so this is a legitimate shootout or comparison, both from the patient side and from the doctor side. A little disclaimer about this topic. It's actually very difficult to find high quality information that compares healthy behavior to drug therapy. Most studies don't view them as mutually exclusive, and in most drug studies, for example, a statin study, the patients are also instructed to eat a healthy diet, they're instructed to exercise. In a healthy behavior study, there's often an expectation that patients will take medication if they need them, according to either their perspective or the doctor's perspective. One of the challenges, though, is that in many of these studies, the details on what was done are scarce. If it's a healthy behavior study, they do a very good job of describing exactly what happened with the healthy behaviors, but they don't say what happened with drug therapy, and vice versa. In studies where drug therapy is the focus, they often hand the patients a brochure that says you should be doing this kind of exercise, etc., etc. But in terms of describing what exactly the patients did while they were taking the drug, the details are often scarce. It's worthwhile taking a step back and saying, what are your healthcare needs? So if you're watching this video, I'm assuming that you think that this is an interesting topic. Immediately when you're looking for good healthcare, you want a physician, a care provider who demonstrates caring in the immediate context. And that often is an important value for you as a patient consuming healthcare. You want relief of immediate symptoms for whatever the problem is that you're facing. You also want improvement in function. So you want to be able to do whatever it is that you're doing a little bit better. And you want that within, days to weeks generally when you see a healthcare provider. But you also want to prevent bad outcomes down the road. And what I'm really focusing on is more of this bad outcome in the future, as opposed to some of the priorities that often are things that we face early on in the care process. If we do a good job of preventing bad outcomes, then we will get relief of long-term symptoms. But the buy-in here is that your time horizon is often 5, 10, 20 years. So it's important to keep this in the back of our mind as we look at this data. The study that I've chosen to look at to examine this issue of healthy behavior versus drugs is the Lookahead trial. And it was published in the New England Journal of Medicine back in 2013. It was published by a very respectable research group. They really were looking at the ideal group to study healthy behavior interventions. And that was a group of diabetic patients where the diabetes wasn't terrible, who demonstrated they were willing to engage in this process of healthy behaviors. It was mainly a study of healthy behavior, but the one difference, and the reason I chose to look at this study, is that they actually did report what happened to drug therapy within the context of this trial. What was the intervention in this trial? Well, the first thing I would say is that they took patients who were on average 59 years old, had diabetes for about 5 years, and were overweight. The average weight in this trial was about 220 pounds or 100 kilograms. The intervention was to aim for weight loss of at least 10% of your body weight. 7% weight loss in a 200-pound person would be about 14 pounds of weight loss. So a significant measurable amount of weight loss is what they were going for. They also had weekly individual or group counseling sessions where they would talk about things like how to exercise, how to eat, how to cook food that is healthy. They really focused on healthy eating, not just weight loss. And all of the subjects were expected to do 175 minutes of exercise per week. So that's 25 minutes a day. And there was an expectation that they try to exercise at least 5 days a week. It's worthwhile taking a step back and saying, what would the cost for this type of intervention be? This will vary from jurisdiction to jurisdiction, but I think in most developed countries, if you look across the whole period of the trial, which went for up to 10 years, it's probably 2 sessions a month at least, minimum, and probably the cost of a gym membership. So where I live, that works out to about $120 a month. If you look at it just over the first 5 years of the trial, or 60 months, then you're looking at about $7,200 worth of healthy behaviors. So what were they able to accomplish? So in the more short term, this graph shows a number of variables that they were able to demonstrate were really affected in a very positive way by these healthy behaviors. So in the first panel, the weight panel, you can see that the average weight went down from approximately 100 kilograms to about 92 kilograms. So an 8% weight reduction within the first year. And you can see that there is some rebound in that weight over the course of the trial, but the weight difference between the group who were doing this versus the group who were not doing this was maintained throughout the trial. Now, you will notice that there was a bit of weight reduction even in the control group, and I'll explain what happened with those patients in a minute. Physical exercise, what they report in this graph is actually the ability of a patient to exercise. They report metabolic equivalence of exercise. And you can see that there's a big increase in the amount of exercise output from the patients within this trial. And again, that was maintained at least through the first 4 years of the trial. They then look at waist circumference, which is a really good way of looking at fat weight, because obviously when you're exercising, some of your weight will be converted to muscle. But if that happens, your waist circumference will still go down. And so again, they were able to show that there was a very significant reduction in waist circumference. And then the last picture on this graph is glycated hemoglobin. Glycated hemoglobin is a marker of how much sugar you have in your bloodstream, a marker of just how bad your diabetes is. And again, they were able to show that in the patients who were doing this really healthy living, they were able to get their glycated hemoglobin down almost into the non-diabetic range. And again, the glycated hemoglobin was significantly better in these healthy behavior patients. Now, I will say that for the patients, the control patients, which in this picture are described in red, these patients were given some brochures and they were instructed to see their normal primary care provider, their family doctor, for ongoing care of their diabetes, whether that be, support for healthy behaviors or getting drug therapy, that sort of thing. The group that were the intervention group got all of their advice around healthy living from the study group. But the drug therapy side of what they were doing, again, was left to their primary care provider because they didn't want to disadvantage patients that had volunteered for the study by not allowing them to have sort of access to drugs if they, if their doctor believed that they needed them. We have what appears to be a lifestyle intervention that is very effective at achieving some of those middle term outcomes in terms of weight loss, improvement in diabetic control, improvement in the amount of physical activity that you're doing. So what was the impact of this on long-term cardiovascular events? This graph looks at the occurrence of cardiovascular events on the y-axis versus time over a 10-year period of time. And what you can see in this graph is that there was absolutely not a stitch of difference between patients who were doing this really great healthy living compared to those that were just doing their usual thing within this trial. To me, when I first saw these results, I thought this was crazy. We have this very effective lifestyle intervention, and yet it's not doing anything to prevent patients from having heart attacks, strokes, heart failure, angina, any of these important things that we think we ought to be doing something to try to lower the risk of. At this point, you take a step back and you say, well, this is crazy. This flies in the face of certainly all of my patients that want to do healthy behavior compared to taking more drugs, because I have good evidence that the drugs that I'm trying to prescribe actually do lower cardiovascular risk. Well, what actually happened to these patients? Fortunately, these study investigators were able to collect good information on what was happening across the full 10 years of this study in terms of drug therapy. And in this graph, we have the blood pressure lowering medications they were taking. We have statins, which we know are effective at lowering cholesterol and reducing cardiac risk. And then we have diabetic medications as well. What you can see in this graph is that the patients depicted in red, which are the control patients who were not doing the intensive healthy living, across all of these drug categories were taking more drug therapy. The patients who were doing the healthy living were getting less drug therapy. And again, that was because if a patient who's doing a very good job in terms of physical activity goes to their doctor, the doctor measures the blood pressure is great because they're doing a lot of exercise, that doctor is less likely to prescribe a blood pressure lowering drug. On the other hand, if you're in the control group, you're not exercising, your blood pressure is high, the doctor may then give you a blood pressure lowering drug. So what happened within this trial is we have one group that were doing a lot of healthy behaviors, and we have another group that were doing less healthy behaviors, but were taking more drug therapy. If you look again at the results, which are that the two groups ended up being about equal in terms of their long-term risk, there's two ways to interpret this data. If you're a glass half empty person, you would say, well, both don't work. If you're a glass half full person, you would say, well, they both work about equally. there's pretty good evidence from a number of randomized controlled trials showing that the drug therapies do actually lower cardiovascular risk. So if you accept that that is true, then you would say that healthy behaviors lower cardiovascular risk and the drugs do too. Now, how do you decide if you've got two equally effective treatments? How do you decide what you're going to do? Well, one way to look at it is what the downside is. And for many patients, cost is a significant factor. Now, within the area that I live, I looked at sort of what the additional cost might be for the extra drug therapy the patients were receiving, and I figure it's probably about $30 a month. As I said before, these healthy interventions are probably about $120 a month. So if money is all that you care about, the most cost-effective way of doing this would be to take the drug therapy. Money is not the only issue. The other consideration is, do you get side effects from your medications that limit your ability to use medications? So I have some patients that say, "Doc, I get terrible muscle pain when I take a statin." That's okay. This study gives me an idea of what I need to tell that patient to do if they want to lower their long-term risk as effectively as they could if they were taking drug therapy. And that is a healthy behavior intervention that involves eating a calorie-restricted diet to lose about 10% of your body weight. It involves doing about 175 minutes of exercise per week. It involves getting coaching from a dietitian, chef, about healthy eating, doing a really good job with your eating. It requires you to be engaged in your health. And if you're willing to do those things, great. That's an option for you instead of drug therapy. It's worthwhile, though, taking a step back and saying, what are your priorities? So this is, again, our graph of outcomes over time, what you need from healthcare delivery. And if you tend to emphasize some of those earlier outcomes, you want a care provider that really has your best interests at heart. You want immediate relief of symptoms. You want to be able to function better. Then I would say for you that your best bet is exercise. Getting involved with a good gym, getting a great trainer. That trainer that you're working with is dependent on your success for their success. They really care about you succeeding. And so you can get those early outcomes. As you begin to exercise, as you begin to eat better, you will feel better. And so you'll have immediate relief of symptoms by getting involved in healthy behaviors. You will probably have some improvement in function. As you exercise more, you'll find your tolerance for exercise goes up. You'll be better at work. You'll be better with your family. You'll be better at play. And so exercise really, I think, meets a need for some immediate return on your investment. Drug therapy, on the other hand, deals more with the long-term effects. So there is very good data suggesting that the drug therapy can lower your long-term risk for having heart disease and stroke-related events. But the drugs don't tend to do much for you early on. And so I think that healthy behaviors and medications go hand in hand in a patient that we're really trying to reduce long-term cardiovascular risk. So who wins the shootout? This is your turn to think about this, and if you have an opinion on this, please leave a comment below. If you are aware of another study that really examines this issue carefully with good reporting of drug therapy use, good reporting of healthy behaviors that we could review, I'd love to hear from you. And yeah, if you have any other reflections that you think are important, please leave a comment below. One other thing that I want to point out that is a different topic really from the shootout topic, but is I think an important topic, is the way the scientific community deals with a study like Lookahead that shows no difference in the primary outcome measure, which was long-term cardiovascular risk, between the intervention group and the control group, the group that did the healthy behaviors versus those who did not. This graph illustrates the number of scientific citations after publication of the trial. And in blue is the Lookahead trial. In orange, I picked a similar study published a couple of years after Lookahead. This was the EMPA-REG trial that showed a significant benefit of a drug therapy in diabetic patients. And what you can see is that the positive drug trial gets a lot more press than this study showing similar outcomes in this trial. And I think this is an important issue. I think that we have really done a disservice to the very important data in Lookahead by simply dismissing it as a negative trial. This is not a negative trial. This is a really important trial with really important insights into what we ought to be teaching our patients. The last thing I'm going to show you is this study that looked at what the cost would be within the US military context per kilogram of weight loss using the healthy behaviors that were used in the Lookahead trial. And in this analysis, they found that per kilogram of weight reduction, it would cost the system about $550. So, depending on how you're feeling about things and how interested you are in healthy behaviors, this was one assessment in that context. In your own individual context, things may be a little bit different. But are you willing to pay $550 to lose a kilogram or a little over 2 pounds of weight? Leave a comment. If you enjoyed this video, please subscribe to the channel. If you want to be notified when I post more content, please ring the bell. Thank you so much for joining me for this Shootout, healthy behaviors versus drug therapy to prevent cardiovascular disease. Thanks so much.
Dr. Dresser does not wish to take any responsibility for his opinions expressed in this video. Nothing in this video should be considered a therapeutic or diagnostic recommendation. If you are one of Dr. Dresser's patients and wish to be considered a good one, please adhere to everything in this video with religious fervor. If you are not one of Dr. Dresser's patients, please discuss these ideas with your healthcare provider.